Welcome back to another episode of the Healthcare Education Transformation Podcast. I am your host today, Dr. Meghan Teitz, and I am joined with Dr. Deanna Lamb, who I am very excited to share with you guys. I got to meet Dr. Lamb at a conference this summer for new PTA faculty, and it was a great conference. I really appreciated all the content that I was able to get there, and then I was lucky enough to get her to join us on the podcast. So how are you doing today, Deanna?
I'm excellent. Thank you for inviting me. This is excellent.
Thank you so much for being here today. So, tell the listeners a little bit about your academic journey, where you started, and how you got to where you are today.
Goodness. Okay, so I'm a PT, an old bachelor's PT from the 90s. And so I started, I was invited to teach a class, one PTA class in orthopedics back in 2003. And at that time, I was running my own contract physical therapy business back when contracts were the bread and butter of PTs. And so I taught one class and I got bitten by the bug for teaching. I thought this is what I'm supposed to do. So as I continued to teach more, by 2010, I became the program director of a PTA program. And I've just enjoyed this journey ever since.
That's awesome. So I know at the conference you presented on some changes that you think would be good for the profession, specifically PTA education. Can you tell us a little bit about your work with that and some of the changes that you think would be most crucial to improving the field?
Okay, so this is like my soapbox. So I don't know how deep we're going to dive into this, but I'll talk about what I'm doing now and kind of go backwards, and we can unpack that as you feel is best. So right now at this small little career college where I am now the corporate director of academic affairs for a small chain of schools that have nursing programs, PTA programs, medical assisting programs, I created a bachelor degree completion program specifically for our PTA graduates because we're a private for-profit institution. So some universities are a little skeptical of taking our credits for a direct transfer in. And so our students, like any other student, have aspirations to go to DPT school. Many, like across the country, 1 in 3 PTA students already holds a bachelor degree, right? And that's just the standard of demographic that we have. So I actually designed a bachelor degree program that I got approved by the Ohio Department of Higher Ed so that our PTAs can then just in 18 months get all their prereqs for the local DPT programs, the physics, the chemistry, the pre-calc, exercise phys. Because a lot of the program completion programs, the bachelor degree completion programs for PTAs actually did not have the prereqs for DPT school. They had maybe some leadership, some administrative strength, some more clinical training. So I actually went backwards. I went to the DPT programs and I said, if I create a bachelor program, what do you need it to be in there so that you accept these students? And so they told me what they wanted, and so that's what I created. So we have a PTA program. I have an online, completely distance ed bachelor degree completion program. I think students need options. And so these students now can get everything they need to apply to the local PT programs. I think we need more options for PTA students in a nutshell.
Right.
In general, I think we need to have that bachelor program option.
Mm-hmm. No, and I don't disagree with you. I do, see some hurdles and hiccups to that. And one of those being that, my program itself is a 1-year fast-paced program where students have to apply with their prerequisites completed, but the institution that confers our degree only offers an associate's. And so what would you say to programs like mine and how we would propose a shift towards a bachelor's that can be beneficial towards that transition to a DPT?
Yeah, so that is the loaded question of the past decade, isn't it? So I have 2 takes on that. The first is, if we compare our profession to a similar profession like nursing, which has truly been pushed to the forefront since COVID and all. I mean, nurses are in high demand, right? We appreciate what they go through. There are so many entry points for a nurse. You can come in at an LPN, 1-year diploma. You can do a 2-year RN associate degree. Your first entry could be at the bachelor, the BSN level. And then you have the MSN, and then you have your nurse practitioners. I think schools need a choice. So in one way, I think if we're only answering the question about what do you do for an associate degree conferring institution, you have that 2-year PTA degree, but you have the option of a 4-year entry point as well. Honestly, if I'm really transparent, I think we have too many PTA programs in this country in light of the decreasing enrollment, in light of lower birth rates, in light of this demographic being much smaller than it was 20 years ago. We don't have that many college age students to pull from. If I had to pick, I would say we should start this field at a bachelor's, and I have a lot of reasons for that, and we can discuss that in more detail. But I don't know that all PTA programs would survive. And this
Right.
is not popular, but I don't think they all should survive. I think we need to trim down the number of PTA programs in the country.
So, I mean, that kind of leads me into my next question because applicants seem to be down across the nation in PTA programs, and a lot of programs are kind of struggling to fill their classes.
Mhm.
I've been fortunate enough to avoid that dip in my applicant basis right now,
Wow.
but that's not the story for a lot of program directors. Do you see an improvement to this problem with your method of education or your proposed changes in the bachelor's degree?
Yeah, so in light of the fact that, birth rates aren't going to change, and at the school I'm at, the PTA program has 5 students in its new class, which started today, 5 freshmen. We have, in one of our cohorts, we have 1 student left coming back from clinicals. Our graduates that are going to graduate this fall, we have 4 graduates. That's not sustainable. That doesn't promote professional development. It doesn't promote equipment maintenance. It's not sustainable. And so, how
Right.
long can you keep that going? My 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 thoughts are to scrap the current system. And this is a pretty crazy idea, but if we were to scrap the assistant altogether and have the entry point be the bachelor's, and here's the reason. Most individuals coming through high school, the smart kids that your parents are, you're thinking, okay, you're going to go to university and you're going to get your 4-year degree, you're going to be a PT, or maybe not. But everyone seems to start at the bachelor program. And then they find out there's actually this thing called a PTA, which is a 2-year program.
Right.
But how many of us parents, if we're honest, we also carry and hold that stigma of career colleges, community colleges, and we want our kids to go to university, like you need to get the 4-year degree. But a 4-year degree doesn't get a single individual into the physical therapy profession. That not one single person can practice in the physical therapy profession with a bachelor degree, but that's where most start.
Right.
So a lot of our PTA students have either done some college no degree, which is a classification, and then they pivot back to a PTA program, or they have a bachelor degree and they reverse transfer. That's called a reverse transfer into a
Mhm.
PTA program. So now you have a 6-year college debt for a 2-year credential. I don't think that's helping anybody. And these students could have just as easily gone the other direction, started at PTA and then go to DPT, and they would have a license on their way to becoming a DPT. So I just think that's a better system.
So, correct me if I'm wrong, but my understanding here is that you feel that presenting it as a bachelor's as an initial entry point would help alleviate some of the social stigma in people initially pursuing a PTA.
Incredibly, yes, well said. So here's the thing: our high schools right now that teach career skills, those vocational high schools,
Hmm.
and career community colleges, they fight stigma, right,
Right.
against what's the 4-year university, and they're fighting the stigma. And so our 2-year colleges and the PTA degree has a stigma, and yet you and I both know that students that come into a PTA degree are equally as qualified as many students who end up going to DPT first.
Hmm.
But if you go to 4-year first and then you come back to PTA, you've wasted a lot of time. And by the time you want to become a DPT, your gen eds are expired, or you didn't have all the credits in the bachelor that you needed. So now you're trying to find courses, and it's so expensive and it's so far. If we started with a bachelor degree, here's a really crazy idea. If the only entry point into the physical therapy profession was to first become a 4-year credentialed professional, and I would propose that we actually call that a physical therapist. The PTA of today is the PT of 1980. And I
Hmm.
can say that because I'm an old bachelor's PT. The PTA of today is a 1980 PT. If we were to start our profession at the bachelor level, as the entry point as a physical therapist, and then all entry comes through that. Then if you want to continue and go to DPT, then you become a doctor of physical therapy. The understanding and building of the profession would be so much more consistent. Every PT student, every DPT student would be a licensed PT1 or, entry level PT. Mike, can you imagine how much stronger our DPT programs would be when we're working with students that come in with a similar level? And I only used, nursing as a reference. They're doing it well. You
Right.
have nurse practitioners that are kicking it. They're
Mhm.
primary care providers, practitioners, but they all came in somewhere, right? And
Right.
so they have a very clear pathway. We don't
Well,
have a pathway.
I agree with that, and I think one of the things that we had talked about was kind of the discrepancy in DPT students understanding what a PTA student learns, but with your proposed method, everybody would understand what you had learned up to that point, and then if you decided to move on beyond that, then okay, everything that you learned to get your bachelor's, what you can delegate, what's in that scope, and there's a lot less disparity for that intra-disciplinary work that I think it lacks right now. I
Yeah,
think that
that's a great
there's
point.
too much that still needs to be built between DPTs and PTAs, where if we eliminated that barrier, we probably wouldn't have the lack of knowledge of what scope is.
Right.
But I do want to ask you, so how do you think that would factor into the autonomy that a PTA wants for the profession? Do you
Right.
think
I
that
think, yeah.
progressing it that way would get us greater autonomy and direct access and all of those things?
Right. So one of the pieces, one of the reasons I'm bold enough to say we need to drop the word assistant off of our profession is because of the stigma it has with reimbursement, respect, understanding. I mean, you and I both know that the average practicing PTA is so much more than an associate degree credentialed practitioner, right? Many have a bachelor's degree at least. Some are second career individuals. They have a bachelor's in something else. They're very deep in their knowledge base, and they're better at interventions than most PTs, right? Our
Right.
PTAs are interventionists. So let's say you don't want to call them a physical therapist. You could call them a physical therapy interventionist because that's what they're an interventionist. And then you
Absolutely.
have the DPT. And so if we could lose the stigma of the assistant, it might completely clean up the 15% or whatever, we're being cut out because an assistant touched the patient. So if we could eliminate the assistant out of our nomenclature and we only have therapists of varying degrees, I think that would build the respect for the profession. It would clean up reimbursement. And like what you said, if we actually had a pipeline for the first level practitioner and then the DPT, we would definitely know what that education involved. And the second thing is a PTA who holds a bachelor degree in a degree completion program or an entry level bachelor's, that in itself should contain every prereq to apply to DPT school. There is
Right.
no reason someone with 4 to 5 to 6 years of college should have to take a single extra prereq to get into DPT school, a practicing PTA. So to me, that bachelor degree needs to become all inclusive of what a program would need for them to apply to DPT school.
Right. I mean, truthfully, we're running into a barrier similar, obviously PTA program, but there's a local university that has a bachelor's in health and human performance. And so much of it is applicable to our program that would fit in with our curriculum to give them a strong foundation and they would be great applicants, but their degree doesn't match our prerequisites directly. And so I'm trying to create a pathway for that degree because I'm like, okay, I understand they don't have these exact courses, but under CAPTE standards, they still have everything I need them to have. And so, can we create a pathway that if you have this degree, it checks the box for these prereqs and get that applicant pool up? Because unfortunately, those students graduate with a degree they can't do much with. And I say that with all due respect because I graduated with a health and human performance
Right,
degree in applied
right,
physiology and kinesiology before
right,
going for my DPT. And that
right.
was always the plan for me. So it didn't scare me to graduate with that. But
Hmm.
a lot of students don't necessarily have a plan, but they stumble into the classes that they like. And you're right. Then they find out PTA is a thing, but they have to backtrack to the associates.
Right. right. And so my dissertation was actually on the success in a PTA program for three classes of individuals: those with a bachelor's, those with no college, and those with some college, no degree. And wouldn't you know it, the class of students who had the lowest completion rate in a PTA program was the some college, no degree. Because these students are ricocheting from one program to the next, and now they're running out of aid. Um, of course, the bachelor degree students did graduate at a higher rate, but you have to think at what cost.
Right.
Um, so those first time students actually did pretty well. But the problem is, again, we are coaching our high school students who are college bound towards the universities. We're not coaching them towards stackable credentials, which is to earn a lower credential first and then build on it, like with the PTA to the bachelor degree completion. And I just think we have poorly managed curriculum creep, which is what you call it when you keep adding more and more contemporary evidence-based practice to what our PTAs have to learn, but we haven't shaved anything off of the curriculum.
Right.
And so there's a disconnect between the licensing exam and stuff we still have to keep teaching, even though we're not doing it in the field.
Hmm.
And so now we keep adding, but we're not taking anything out. And who gets to decide what we take out? I just think if we step into the bachelor arena, no, not everyone gets to play, not everyone can do that, but we have a decreased pool of college students at this point, and we need to look at reality. Look at the birth rates. We aren't we don't have the family sizes. We don't have the college student pool that we had. Health care is more complex, right? The PTA celebrated the 50th birthday in
Hmm.
2019, and we're still at the associate degree, right? And so, and we've evolved our PTs from bachelors to doctorates, and I don't know that the education of PTAs is meeting the need of our profession, and so it's putting us at a disadvantage when compared to other professions for sure.
No, I hear you. I think you make some valid points, and at the very least, you've given our listeners some great things to think about. Because I do think there's a balancing act to consider, especially in people wanting to get to the field quickly. But as you're pointing out, people aren't necessarily getting to the field quicker. It's in ending up taking them longer. And so, how do we balance that and make things best for the field, the future students, and all of that?
Yeah.
So, if you could give any one piece of advice to educators, administrators to try to advocate for a shift in this direction, what do you think is the most important?
Just start, just try. So, you have time for a quick story?
For sure.
Okay, so back in 2012, I was selected in the second ever ELI group, the Education Leadership Institute Fellowship. And I was sitting in the van. We were going to dinner. It was one of our on campus intensives. And I was sitting next to the program director of ELI. And she nudged me and she said, Deanna, she goes, you need to recreate PTA education, change how clinicals work. You need to solve some of these problems. And I was new to PTA administration. And I said, listen, I am the least credentialed person on this bus. I'm a little old bachelor's PT with a master's in counseling at a little private for profit career training school that didn't even
Hmm.
have the word college in its name.
Yeah.
And you want me to shake up PTA education in the nation? And she said, Dana, you're as qualified as anybody. I'm sitting here with all these PhDs and DPTs and PT program directors that are starting all these new hybrid programs. I'm like, I'm just this little. But you know what? Something got me stirred up that day. And so here I am now,
Hmm.
and I co-direct the workshop with Michael Pagliarulo here, who we met because he was my mentor at the Eli Fellow. He was my mentor, and he pushed me. And so then I thought, you know what? We need to create this bachelor degree completion program. And so I did, and it took years to get it going. And here we are. And so I would say to that faculty member, that person, just try something. I've been
Yeah.
involved in a lot of initiatives nationwide, and I'm nobody special. I just said, okay, I'll do it. So I would say just get started. Look at your idea. Find a team. Join the SIG. Join the APTA Special Interest Group for AP or for PTA educators. Go to the conferences. Get on some task force groups, and just start somewhere.
I mean, every great journey starts with a single step, so I
It
can't
does.
disagree with that advice at all. Well, Deanna, thank you so much for taking time to chat with us today. I think we've covered some great topics. I think you've given our listeners some great things to ponder, and hopefully we can see some changes going towards that bachelor's overall for the PTA degree.
Awesome. Thank you for the chance.
Thank you. Well, you have a good one.
All right, thanks.